Okay, so I had a question on the YouTube channel this morning, and it was, hey, I had one vial of filler 5 years ago. It looked amazing. Then I went somewhere else. The person went to a board certified plastic surgeon, had 4 vials of filler. So this is 5 years later, and saw no results at 3 months. And I said, well, that could be normal. It was done in the chin and the jawline. And I always talk about the chin and the jawline. Oftentimes people need 4 or 5 syringes. Now, I can't tell exactly what happened to this person. They could have got product that wasn't real. It could be a different product that metabolized quicker than they had before. It could be that their metabolism is more, but the most common thing, because a lot of fillers are more similar than dissimilar in terms of hyaluronic acid types, and I'm going to waste one today, so watch this, but the most common thing after 5 years is someone aged 5 years. Now that sounds weird, they age 5 years. Yeah, in 5 years you age 5 years, but not all 5 years are the same. And the reason is, when you're 20 and you age to 25, it's not a big deal. When you're 50 or 48, 46, particularly for a female, and you age to 51, 52, 53, it's a much different aging rate. And you can watch my whole video on aging rate. And it's why we talk exercise, we talk vitamins, we talk about diet, we talk about all the things to keep bone in the face, vitamin K2. But I wanted to show what one vial of filler is so we know why this may have failed. Because 4 or 5 vials, yes, could get sucked up in the face, especially if there's a pre-jowl, hanging jawline, and you get osteoporosis. Not a lot of people talk about it, but bony changes make people look old. Fat and fat pads make people look tired, shifting of the fat pads. So let's look and see what one vial is. So here's a complete vial of filler that, yes, could be going into your face, but is now on my glove for the sake of showing people what one vial of filler is. So if I took 5 of these, I would make a teaspoon. 15 would make a tablespoon. 5 mLs, 15 mLs. But there's 1 ml of filler, and you can see if you put that in a face, a complete face, it's probably not going to do too much. It's probably going to get lost. And the farce of it is when people show temples being filled with 0.3 or 0.5 up on stage, and they say, well, this is going to fill that temple. This is deficient by 5 of these at least. And then you need G prime or pressure to pop that. So it looks good on stage for the first 5 minutes, but then they go home, they're disappointed. So in the real world, in real practice, in real life, it's very difficult to do anything with one of these in a complete face. So to answer the question to the person here, that could be totally normal. What do you think? Stay tuned here. Keep your skin and body beautiful, healthy, and vibrant.